Ready.
Come in.
Hi, my name's Amanda. I'm going to be your student nurse for today. I'm going to shut the door/curtain for your privacy and wash my hands before we get started. All right. So, do you have any pain I should be aware of?
No, I do not.
What about any allergies?
No.
Okay. Can you state your name for me, please?
Monica Shepler.
All right. I'm just going to double verify. All right. And your date of birth?
April 30th, 1996.
Okay. And the patient looks their stated age. I don't see any obvious signs of illness. Can I ask you a couple questions?
Yes.
All right. What year is it?
It is 2016.
Okay. Where are you at?
University of Detroit Mercy
And why are you here?
for physical head to toe assessment.
Okay, and the patient is alert and oriented ×4. Her mood looks appropriate for the situation with a matching affect, and everything seems okay there. Her speech isn't garbled or any abnormalities with that. All right, do you mind if I touch your head?
No.
Her cephalic feels normal, no masses or tenderness, right? Did you feel any tenderness?
No, I did not.
Okay, and no lice or anything in the hair, and the hair is distributed appropriately. Her grooming seems to be okay, along with her hygiene, which is good. All right, do you mind if I shine a pen light in your eyes?
No, I do not.
All right. Okay. All right, the pupils look equal and round, and they react to light and accommodation. I'm going to check your conjunctiva. Okay, nice and pink. That's good. All right, and now I'm going to go on to the carotid arteries, okay? Or actually, I'm sorry. I'm going to test your cranial nerve number 5 and 7. All right, can I have you tighten your jaw? All right, I can feel you clenching. It feels strong and equal. And can I have you puff out your cheeks? Smile. Okay. The cranial nerve number 5 looks good. Now for cranial nerve number 7, can I have you close your eyes and tell me where I'm touching you?
Forehead, nose, cheek, chin.
Okay, cranial nerve number 7 is intact as well. You want to come more this way. Okay, and now I'm going to go on to your carotid arteries. So I'm going to feel them one at a time. Okay. Carotid arteries feel nice and strong. I'd rate them a 3+ actually. And they are equal bilaterally as far as I can tell, checking them one at a time. The trachea is midline. I need to listen to the carotid arteries with the bell of my stethoscope. While I do this, I'm going to have you hold your breath, okay? So deep breath. Okay. Okay, you can let out. All right, so no bruits noted on the carotid arteries. So now I'm going to check your mouth. Oops, wrong way. Can you open up wide for me, please? All right. The teeth look good. Got one cavity going on. No missing teeth. No lesions on the oral mucosa and the buccal mucosa. And the skin is nice and pink and moist in there. And the gums aren't retracted. No signs of gingivitis or anything. Can I have you go, ah?
Ah.
Okay, the uvula retracts nicely and you have no tonsils, correct?
Correct.
Okay, so 0 for the tonsils. And now I'm going to go on to the upper extremities. Okay. Looking at them, the color looks appropriate for the ethnicity. Nice and warm. And no lesions or moles to be concerned about. All right. So I'm going to feel the brachial pulse. All right, they feel about a 2+. They're strong, but not abnormally strong, and they're equal bilaterally. Now on to the brachial, or radial, I mean. All right, equal bilaterally, and I'd rate them a 2+. They're nice and strong. Now I'm just going to check your capillary refill of your fingers. All right, the capillary refill returns within 3 seconds, so that's good. I don't see any signs of clubbing in the fingernails. Alright. And now I'm going to go on to your heart sounds, okay? Alright. So I'm going to do this with the diaphragm to start. I'm going to start at the aortic, which is the right sternal border and second intercostal space. And now to the pulmonic, which is the second intercostal space, left sternal border. Herbs, which is the third intercostal space, left sternal border. Tricuspid, which is the fourth intercostal space, left sternal border. And the mitral, which is the midclavicular line. And this is also where you would take the apical rate for 60 seconds by counting the beats. And now I'm going to go backwards with the bell of my stethoscope. Okay, and the heart sounds are regular, and I could hear the S1 and S2. And now I'm going to go on to your lung sounds. Is that all right if I have you deep breathe for me, please?
Mm-hmm.
Okay. So I'm going to do this with the diaphragm of the stethoscope. All right, can you take a deep breath for me, please? All right. I'm going to do this in 10 spaces. And check laterally. Alright, so your lung sounds are vesicular for anterior. Now I'm going to check posterior. Deep breath in and out. In and out. In and out. Okay, so lung sounds posteriorly are vesicular as well. No adventitious breath sounds noted. All right, can I have you lean down for me, please? All right. The spine feels good. No abnormal curvatures noted. And now if you could sit up. I'm going to check your costovertebral angle. Let me know if you feel any tenderness.
No.
All right, other side. Okay. And your antero-posterior diameter looks to be 2 to 1, which means there's no barrel chest, so that's good. All right, if you could lay down, I'm going to check your abdomen. Oops. All right, so I'm going to start with inspecting it. All right, so looking at the stomach, I can see that there's no scars or moles or anything to worry about as far as the skin goes. The color looks appropriate. And it's nice and warm. All right. The contour is flat. And now I'm going to go on to auscultate the stomach. I'm going to do this with my diaphragm. And I start with the right lower quadrant. I can hear bowel sounds present. And the right lower quadrant contains the cecum, the appendix, the right ureter, and the right ovary. And then I'm going to go to the right upper quadrant. Bowel sounds are also present here, and it contains the right kidney, the liver, and the gallbladder. Now onto the left upper quadrant. Bowel sounds are present, and it contains the spleen, stomach, and the pancreas. Left lower quadrant, which contains the descending colon, the left ovary, and the left ureter. All right, so the bowel sounds were actually hyperactive. And now I'm going to go on to percuss. And I could hear tympany with percussion, which means that there is a hollowness where the organs shouldn't be. And now I'm going to go on to palpate. This is light palpation done with 3 fingers. Okay. And I didn't feel any abnormalities with palpation, no masses or anything felt. And the belly button looks midline. Everything seems appropriate there. So I'm going to pull your shirt down. If you could sit up for me, please. All right. When she sits up, I was watching for a jugular vein distension, which I didn't know any presence of jugular vein distension. All right. Now I'm going to go on to your lower extremities and just taking a look at them. The color looks appropriate for the ethnicity. The hair is shaved off, which is appropriate for being a female. And the temperature is nice and cool. Okay, and I'm going to check for edema. No pitting edema is present. Now I'm going to check the popliteal pulse. I can feel her popliteal pulse, but it's kind of weak, so I'm going to rate it a 1+, but it is equal bilaterally. Now for the posterior tibial. I'm going to rate that a 2+, and it's equal bilaterally and nice and strong. Dorsalis pedis. I'm going to rate that a 2+ as well, nice and strong and equal bilaterally. Now I'm going to check the capillary refill of the toes. Your capillary refill actually takes longer than 3 seconds in your toes, so I'm going to note that in your chart. All right, now I'm going to check your Babinski reflex. So I'm going to use the blunt tip of the object and go up. All right. Okay, and there was no fanning of the toes, so that means a negative Babinski reflex, which is appropriate for you. Okay, so now we're going to do something called the get up and go test. Can I have you stand up for me, please? All right, and just take a little walk across the room. All right, her gait is steady. There was no shuffling or unsteadiness going on, so the gait is appropriate. Did you feel any dizziness?
No.
Okay, so that's good. And now I'm going to do the Romberg test, which is where I'm going to have you close your eyes, and I'm going to stand right here in case you fall. I'm just going to have you do this for 20 seconds to stay still. All right, and after 20 seconds go by, if she doesn't fall and there's just some slight swaying, everything is normal, and she passed the Romberg test. Is there any questions?
No.
All right, thank you.